Hello, everyone. Welcome to our pop-up session on primary healthcare at the 71st World Health Assembly. We're very happy you're all joining us. We're going to be talking today about the past, present, and future of primary healthcare, Alma-Ata at 40 years. And we have with us today some very distinguished panelists who are going to share their perspectives on how primary healthcare has changed over the last 4 decades. On my left here, we have Minister Yelzhan Birtanov of Kazakhstan, who is going to be graciously hosting this year's global conference on primary healthcare, and he'll be sharing more information about that shortly. We also have Vidhya Ganesh, who is joining us from UNICEF, where she is the Deputy Director of UNICEF Program Division. On my right, we have Hans Kluge, who is the Director of the Division of Health Systems and Public Health and the Euro Office for the World Health Organization, and Ed Kelley, the Director of Service Delivery and Safety in the Health Systems Cluster at WHO headquarters. So thank you all for joining us. As I mentioned, this year is the 40th anniversary of the Declaration of Alma-Ata, which was really a landmark statement about how primary healthcare contributes to health and health systems globally. And we're really excited that on the occasion of the 40th anniversary, we have an opportunity for the world to recommit to this really crucial principles and approach to health systems. Minister, I'd like to start with your perspectives, if possible. Could you share a little bit about the legacy of the Declaration of Alma-Ata and why this year it's important for us to revisit primary healthcare in particular?
Thank you, Shannon. Very pleased to be here on this event, on this very important topic for all of us. Yes, Alma-Ata Declaration, it's known as a historic declaration in global healthcare, and that set up the highest priority of primary care for all health systems. And the main, I would say, issue when we talk about legacy is that based on that declaration, all countries in the world, they put the primary care as the basis of their national health system, so as Kazakhstan. So based on that approach, today we talking about the extremely best outcomes of health systems around the world with decreased mortality and raising the average of length of stay and quality of life around the world. So I think the primary care is actually the main factor that contributed to that, including my country, Kazakhstan, because of course hosting the declaration as a part of the Soviet Union at that point, we were proud to have the system that was designed according to the declaration. And for my country, for these 40 years, it was the highest priority, even in difficult period of economical transition when we became independent state back in 1991. The political priority is to keep primary care service going on. So today, primary care is involved not only like a first entry point for every citizen to the system, but actually the main tool for disease protection, disease prevention, prophylactics, vaccination, raising the awareness of population, but also, of course, as a tool that primary care specialists can lead people through complex health system. So that's why it is important. And of course, since 40 years, there are a lot of new trends with demographics, with epidemiology. We have more elderly population, aging population. We have a lot of issue of migration and growing number of chronic diseases, non-communicable diseases, and of course technological breakthrough. That really needs for us to discuss the future of primary care, having this historical basement, but we have to think about the future. So we hope this conference this year that will happen in my country will help us to bring all the best stories, all the success stories, to define the future ways for development. Thank you.
That's really wonderful, thank you. And we're very fortunate to have a minister hosting us this fall who's so invested in primary healthcare as an approach for his country, so appreciate that. Hans, over to you now. We've heard a lot at this year's World Health Assembly about universal health coverage, and it's often said that we won't be able to achieve universal health coverage without primary health care. Could you shed a little light on why that is true? Why is that the case?
Yes, thank you very much, Shannon. Indeed, universal health coverage is the overarching priority in the GPW13, is the new vision of WHO. In a nutshell, universal health coverage means that every patient, every person in the community should have access to quality health services, including, as Dr. Birtanov was telling, also prevention and promotion, in fact, up to rehabilitation, palliative care, without being pushed into poverty due to ill health. The way to do this, the core strategy, is integrated primary health care. Why? And I speak both as a director of health system and a previous general practitioner. It's that people find their way very easy to the primary health care, which includes also community care. So it reaches the otherwise unreached. And the key value there is the trust. This was the same for me as a GP. You are the general practitioner, the family doctor, not only of your patient, but a friend of the family. So it puts people in the center. You look at their health needs, but also their social needs. And that's the spirit of the Alma-Ata Declaration, the so-called social deterrents of health. In the United Kingdom, for example, last year, 10% of the consultations in the primary healthcare had nothing to do with health. It was about housing. People didn't know where to go. And that's my final point. The healthcare workers, the health professionals of the future, the current ones, are so important because they are the ones who are trusted by the community. And what we hope to do, among other things, at the conference in Astana is through this global movement of UHC, underpinned by PHC, to increase the prestige of the health professionals. Because without the health professionals, without the volunteers, without the community, we are not going to have strengthened primary health care to go to UHC.
Thank you, Hans. I think with this idea of the community and people really being the heart of primary healthcare and the essence of why primary healthcare is important, primary healthcare also being the point where people and the community meet the health system, I wonder, Vidhya, if you could say a bit more about how primary healthcare promotes multi-sectoral approaches and community participation.
Thank you, Shannon. The primary healthcare is at its best when the community and the service delivery seamlessly integrate. There's almost no point where one stops and the other starts. And for that integration to happen, it means we are not dealing with one issue. We're dealing with issues that affect the community and the people. And it means all of the issues around health, nutrition, water and sanitation, and even access to primary education, because all of them actually have to come together. And whether we call it multi-sectoral, or I almost call it obvious. So, and the primary health care through the healthcare delivery system, and where the community groups can prioritize what their local needs are and actually make the system and the community mutually socially accountable, it achieves the many benchmarks that would be the ideal success for a primary health care. And when it comes to, and the second point, primary health care is also at its best when it reaches the most vulnerable and the most marginalized and the most left behind. Of course, we don't say that it's only the women and children are the most vulnerable, but in fact, they do face more vulnerabilities than many others. So when we look at child survival, growth, development outcomes, those outcomes are not just about avoidance of diseases, but it also about prevention and promotive. And more recently, we've started to really emphasize the importance of early stimulation and early nurturing. So the idea that we just heard from Hans, that the health outcomes are actually the products of what happens at the household, and that are supported by the communities and then supported by the system.
Just a quick follow-up to your last point. Could you share a little bit more about how you see the platform of primary healthcare really being able to impact the health of children and adolescents in particular?
Well, the primary healthcare has brought about a revolution in reducing infant mortality and maternal mortality. That wouldn't have happened without the vision of a primary health care, which first of all puts health as a human right at the center of it. So it's non-discriminatory, it reaches all. And the other thing was the primary health care, because of its wanting to reach every child, every woman, everywhere, it put the impetus on really coming up with high-impact interventions that are low cost and easy to deliver. That's the hallmark of the primary health care. But as the minister said, that same primary health care system has to deal with other issues that children, women, and adolescents face. It's no longer only about vaccine-preventable diseases or malnutrition. Malnutrition along with obesity, the psychosocial support services that they needed. So the primary health care also therefore needs to start looking at how it's going to build in the future needs. Because primary health care can't be selective about what it will do, it will not do, if it's truly about responding to the community needs and needs of the people.
One of the things that the global community is struggling with right now, building on what you all have said, that primary health care is extremely effective. It's the best way to organize a health system to get the outcomes that we're all seeking for all people. It's cost effective, meaning you can do the same thing within this platform that might cost more at other parts of the health system, such as hospitals or specialty services. And it has this emphasis on equity. So really, in the era of the SDGs, our focus on leaving no one behind, it's so essential. But one of the things we as a global community have to recognize is that we haven't made the progress that we would have liked to have seen in the last 40 years. So Ed, I wonder if you could tell us a little bit about where we stand now with primary health care, where we've been successful, where we still have some lessons to learn, and how we can apply those lessons to make primary health care the approach for achieving universal health coverage in the 21st century.
Yeah, it's a great question, Shannon. It's one, obviously, we as a group thinking about this conference get a lot. None of us was there personally in 1978 in our current capacity, even though a few of us are older than others. But we had, very interestingly, some of the people here listening would have been in the side event that was scheduled here at WHA yesterday, technical briefing rather, yesterday, where we had young professionals saying that they sat in the chair 10 years ago and attended the 30th anniversary, kindly hosted by Kazakhstan, and many of the same things were said, the emphasizing primary care, the equity agenda. We really need to advance together on this. And so I think there is always this point to be making that we have to realize that it takes many times saying something before it happens, and it takes a lot of work before something happens. But I think there's clearly some lessons that we can learn that we approached, probably if we can boil it down, the challenges of the past 40 years in too separate of a manner. Different organizations didn't work enough together and different sectors didn't work enough together. So I think that's our big first lesson, is that in order to accomplish the promise that we have in front of us, it has to be a multi-sectoral work, and it has to be the whole international community working together. Secondly, I think this whole idea of partnering with the private sector needs to really come to fruition. It's something that in many of the countries that WHO works with, delivering on primary care won't happen unless the private sector is involved. And third, it's a big change now in terms of the technology and what it's allowed us to do. The types of services we can offer in primary care would have boggled the mind of a primary care provider 40 years ago. And most of our patients now, maybe not my dad, but certainly me and my children, will use this to get their first health information rather than talking to their their primary care provider. And so we need to be where people need that information and where they want to be treated. So the sort of future orientation of this has us with a different kind of supply of services. It's much more digital, that's not about four walls, it's much more in the community. But it's also because it's a different demand. People want something different. So I think that will be one of the big changes that we'll try to take on board in Kazakhstan and take forward.
To say that the conference in Kazakhstan sounds like it will be an extremely important event with lots of really critical topics to advance us forward on this agenda. We have a few minutes left in our time together to take some questions from the audience here with us. So if anyone in the group might have a question, I would just ask that you come here to the podium, and please feel free to inquire on your burning questions about primary health care. While we're waiting for our first question. Yes, please.
Good afternoon, Minister. I'm very pleased to join. My name is Yoshi Goe, International Telecommunication. And thank you very much for the invitation to this Astana conference. Our Secretary General is pleased to come to this conference. May I ask, Minister, what's the expectation to collaborate with this multi-sectoral, multi-agency? In particular, ITU is very committed to connect the people wherever and whatever that means. So what's the expectation of this collaboration for this conference? Thank you, Minister.
Thank you for asking this question. Thank you for overall supporting us in this event. So, of course, for us as a hosting country, we have we're very excited about this event, and our main target and the main is to bring the best discussion on the table, to bring the best successful stories that we have at the moment, all the best lessons we've learned, not only the good stories but also bad stories, because during this assembly and previously during the meeting of International Expert Advisory Group, many experts were saying that we haven't reached all goals of Alma-Ata Declaration. So this time we have to be very strict on the ideas, but also on the implementation of those. And also our expectation is that there will be more participation of younger generation, future health leaders, and we can really talk about the key issue of technology. And that's also, for us, it's we want to bring all the best experience already that we have in digital e-health system, specifically in primary care level. As Ed mentioned today, the role of mobile devices could be critical for overall redesigning not only primary care but the whole healthcare sector. So we also expect that countries will share with their successful stories and experience that they have in this area, so we can see what directions we have to move and what are the future in this area. Thank you.
Thank you very much. I believe we have another question from the audience.
Hello, everyone. I'm Kaia Kasekamp. I'm from the ministry from Estonia. And as all of you, or some of you might know, that we are also hosting the Tallinn Charter Jubilee Conference this year on health system strengthening. And I wanted you just to elaborate on that. How do you see what role the strong primary healthcare fills in the strong healthcare systems? What is your perspective on that? And I hope also, dear Minister, that you have the chance to participate on the Tallinn conference and you can find some input to the Alma-Ata Declaration anniversary event.
Thank you. That's an excellent question. Hans, I wonder, since you're intimately involved in both processes, if you would be willing to take a first answer.
It's great to point out the other anniversary, the 10th anniversary of the Tallinn Charter, which will be on health systems strengthening for prosperity and solidarity. So we're going to exchange the experiences in health system strengthening since 2008, the Tallinn Charter, not only from a perspective of the Ministry of Health, but also the Ministers of Finance, to sharpen our dialogue that investing in health and health systems is investing in inclusive economic growth. Coming to the primary healthcare, at the end of the conference, our ambition, it's quite ambitious, is to put forward the vision of people-centered health systems resilient health systems for the 21st century. And it will be centered around an integrated primary healthcare system for the reasons I was mentioning at the start. But very important, the word integrated. So the primary healthcare being very close to the communities, being very cost effective, having the trust of the communities is central, but in very good relation with the other parts of the service delivery, like the hospitals. This is something that was a little bit antagonized in the past. In fact, the better the primary healthcare works, the better for the hospitals, because then they can focus on what they should focus on to manage complicated cases, because we know that in many countries up to 70–75% of the disease events managed in hospitals can be managed in a more cost-effective, patient-friendly way in the primary healthcare. So a strong primary healthcare doesn't mean anti-hospital, it means also a stronger hospital system. The same for the public health services, the same for the long-term care, because we're facing aging of the population in many. So that's in a nutshell that the primary healthcare also will underpin the, let's say, new outcome statement of the Tallinn Charter. Thank you.
Thank you very much. We are drawing our time here to a close. Before we leave, I wonder if each of you would share some brief closing thoughts about what you're hoping for the future of primary healthcare.
For us, in my country, I would say, grew up under the historical feeling of Alma-Ata Declaration. Although we were not there, but for Kazakhstan, it's very critical to be part of this process. And of course, we want to participate actively, to host the conference, to have the best minds, the best ideas, and to set up the as long as possible long-term vision for the future of primary care. And our vision is that primary care should provide really equal access to all people for the best technology and for best care. Thank you.
I think I'll have two thoughts, if I'm allowed. The one is the Alma-Ata Declaration has inspired generations of public health professionals. So I hope this conference in Astana continues to enthuse many more, because a good, strong public health, which is multi-sectoral in its orientation, is the best investment for the future of for any country, which means that the children benefit the most. My second thought is, I think we finally have a creative opportunity to think out of the box about what does prevention actually mean. A prevention that is inclusive of participation of adolescents, participation of community, so that they're generating their own health where they are. So I think the opportunity to think about prevention and promotion through this new vision for primary healthcare is going to be very exciting.
Thank you. For me, it is Kazakhstan once again, and the personal leadership of Dr. Birtanov as well, and the president, putting on the stage that primary healthcare is the core strategy leading to universal health coverage, leaving no one behind. Because we are a continent and global health community which believes in the social values of equity and solidarity, and we see in many places they are under threat, particularly for minorities. So that the conference will make it very clear at a very high level, we are leaving no one behind. Primary healthcare is a big part of the solution.
For me, I would have the thought, since Vidhya got but I mean, first, I think it's the opportunity that we have for actually working together as an international community. Sort of these kind of events don't come around that often, that go back to the very history of the organizations, and it's a chance really to bring everybody on the same page. Somehow you often work in this world where everything is a zero-sum game, and and I think this provides this opportunity of us all moving a common agenda. And secondly, I think that the opportunity for kind of advancing and coming back to the roots of the equity agenda, as Hans said, within the UHC movement. It makes, at some points, as someone who spends a lot of time talking about UHC and people-centered services, people say, what does that mean? I don't understand it. What is it? And it's very concrete entry point to advance this UHC. It's not an amorphous thing, universal health coverage. It starts with primary care and moves on from there. But I don't know, lastly, I think it would just be, in many parts of the world, many countries, rich and not so rich, the people have lost trust with their governments somehow. There's a disconnect in many parts of the world, and even if it's not the whole populations, it's subpopulations. And I honestly think that the primary health care and universal coverage movement is the opportunity for governments to recreate trust with their peoples. It's about people thinking that their governments care for them. So I think that's a big opportunity we have.
Thank you very much for those closing thoughts and for spending the time with us today to discuss this really important topic. I want to thank our viewers, both here in person and online, for joining us today. We hope that whoever you are, wherever you are, whatever your role is in health systems, that you'll join with us in the global community this year and moving forward to the future to advance primary health care. Thank you so much. Bye-bye.